Hello and welcome to Voices in Health and Wellness. This is the podcast where we speak with healthcare leaders, practice owners and innovators about the realities of modern healthcare. On this show, we explore both the clinical and business side of healthcare, covering patient care, practice growth, industry trends, leadership and the challenges facing independent healthcare providers today. Today's episode tackles a topic generating significant interest across healthcare, longevity and aesthetic medicine. Regenerative medicine. Is it genuine innovation, industry hype, or the future of how we approach aging? Joining me today is Dr. Philippe Hamida, owner and director of PHP Health First and PHP Aesthetic, based on London's Harley Street. Philippe has built a practice that combines aesthetic medicine, dermatology, wellness, and private medical care with a philosophy centered on addressing the root causes of aging rather than simply treating visible symptoms. His approach integrates lifestyle, nutrition, stress management, and preventable health alongside traditional aesthetic treatments, giving him a unique perspective on the growing connection between aesthetics, longevity, and regenerative medicine. So with that, Philippe, I'd love to welcome you to the show, and thank you so much for joining me today.
Thank you, Andrew, for the nice introduction. And thank you for the invitation, because the longevity is it's been part in my practice for quite a while. And with your podcast, I think it will be very interesting to develop more in depth about how we can implement the longevity in our practice on a daily basis, really.
For sure, and I'm really looking forward to this conversation. But before we dive into regenerative medicine, would you mind just telling us a little bit about yourself, your journey into medicine, and what led you to create PHP Health First?
So I'm a French doctor, obviously. I'm based now in London, but my major clinic is in London, but I have two other clinics abroad. So I set up the PHP. PHP is my initials, but also is private healthcare providers. So professional healthcare providers, apologize. But it was about, dermatology first. And then we not change 100%, but we expand to the aesthetic side, not because we wanted to do it, it's because our patient asked us to provide some aesthetic treatment. Obviously, we provide other treatments as nutrition, wellness. In fact, it's more the concept of 360 degree. We do more on a holistic approach. It's not only, looking good from outside, but also is looking good from inside. And this is, for us, is our philosophy, is when we call the French touch. But the French touch is not only the way we look, it's also feeling good inside, because we know that there is impact from inside to outside and vice versa. So our approach is really holistic, is a full 360 degrees approach in our clinics.
Amazing. And on that point, one thing that really stood out from our previous conversation was your belief that aesthetic medicine shouldn't simply focus on the visible signs of aging. And you talked about addressing inflammation and stress and nutrition and lifestyle and other underlying factors. So how do you describe the relationship between aesthetics, wellness and longevity?
So this is very interesting questions, because when patients come for aesthetic treatments, they ask, for example, I want you to get rid of my wrinkles, but I want to look younger. So in fact, the two questions, aesthetic and longevity, they ask at the same time. So this is where it can be separated, but they can be a bit combined. It's like if I'll take another example. If we take exactly two twins, sisters or brothers, we put in different setting, one on the stress and the other one with the normal situations. If they have the same skin issue, example, acne, we will notice that one treatment is going to work on one, but the same treatment is not going to work on the other one. So what we do dermatology clinic, our always questions is, why is it not working? What is not working? Why this cream? What cream you use? What are your routine and so on? But our question is not why the treatment is not working. So really, we need to look deeper. Why on two patients, one treatment is working really well, but the identical treatment for the identical condition is not working at all. So it's allow us to push deeper and not just to change a treatment, or this one is not working, that one will work. Because we know that if we don't search deeper, sorry, I repeat myself, so the treatment is not going to work. So we need to deep more information to understand what is the underlying condition for the medication or the topical cream not to work.
Got it. So when somebody comes in requesting Botox or fillers, how often do you find the real issue involves broader health factors from your experience?
So we need to realize that with experience, we're getting more, it's easier to talk about everything, first of all. When you have returning patient, it's as well easier. So when you have a returning patient and they say to me, oh, you know, my Botox or my filler doesn't last as long. So it's where we need to start to ask the question, you know, the consultation, the most important, I remember when I was in the hospital in France, my mentor used to say to me, Philippe, the first consultation is the most important. If your consultation doesn't last 1 hour, your patient is not going to listen to you. So you have to be very focused on the first consultation. And the first consultation, it's all about lifestyle as well, because you cannot just to talk about, oh, I've got some wrinkle, or I've got some deep lines, or I've got XYZ. We need to ask the lifestyle, the food habit, do they exercise, any history. There is the medical questionnaire need to be very wide, very deep, and not just, you know what, you have wrinkles, I'm going to target your wrinkles. We need to push it for them to realize that, yes, there is so much we can do, but we do 10% by injecting, for example, botulinum toxin, but 90% is from the patient side. So we correct, but it's a quick fix, in fact. The rest is come from the hands.
I mean, I don't know how long you've had the interest in wellness and longevity, but was there a particular point when you kind of really latched onto this and realized the leverage that you could have by incorporating this into your practice? Was there some, like a patient episode or a particular thing that triggered you? Because I guess you may not have been doing this all through your medical career. I'm just interested at what point this became, you know, really, really pertinent to you.
So this longevity, I'm going to be. It's more recent. When I say recent, it's a year or 2 years. Since I had 2 models, I deal a lot with models. And when my treatment routine did work really well on one models, and the same treatment for the same condition did not work at all. So it's starting to queries, okay, what else could I offer to the models which the treatment did not work to help her to understand the condition? The other thing as well, the other point, it's I had a very good friend who suffered from psoriasis, and one day no treatment were working and so on. And one day I sat with her, I sat for 2 hours, and I explained to her the etiology of the psoriasis. And I told her if she understands the etiology of the psoriasis is already 50% of the treatment. Because if you don't have an understanding, so you just have to believe. And we know that we're losing patients. So patients as such. So they want a treatment, but they want an effect straight away. It doesn't work like that. It has to be, first of all, a trust relation with the practitioner, but also understanding of the step-by-step, because we're never going to offer, it has to be step-by-step to see if the patient follow. Because if the patient doesn't follow, is no point. I'm wasting my time, they're wasting their time, so there is no point to go further.
Thank you. So would you mind just telling us a little bit about your practice as it stands, PHP, and what does a typical, I guess there's no such thing as typical, but what does a typical patient journey look like, and how might that differ from a conventional aesthetic practice?
So, first of all, we are French practice, and now we are French-Korean practice because I have a Korean doctor joining us. So it's all about again as well, the holistic approach. So what I wouldn't say make a difference, because at the end of the day, we provide some service. We have the same type of patient coming to our clinic, but we able to go deeper in our consultations, to push further. This is because we established for a long time, so we're not worried about asking some it might be some strange questions, but some normal questions that we do in the NHS. Do you smoke? Do you exercise? Is some questions that in aesthetic practice clinic sometimes we forget to ask, but it's very important. If we want to have a treatment to last longer, it's very important to understand what they're doing, because if we explain to them that what we're doing, instead of having an example, Botox every 3 months, if they listen to them, if they give us all the information, Botox every three times a year, sorry. So they might need the Botox only twice a year. So it's going to be a saving. The botulinum toxin might last longer. The same for the filler. The same for exosome. We're going to have a better response with exosome, stem cell, and polynucleotide. We know that is a trend right now. So it's how we approach the patient to let them know that Botox fillers are quick fix, but we can make the treatment last longer, as long as we can push the consultation further, and to try to help them to understand what they could do to get a better outcome, really.
Thank you. And has patient awareness changed over the last few years in respect of this more holistic approach? Or are you somebody that's having to kind of, educate them on the value of it?
So definitely the patient awareness, it's higher now because of the internet. They're all linked on internet. They start to look at it. But indirectly, like I was saying to you before, they, without realizing, they ask us two-in-one questions. I go back to a question I did mention previously. Can you deal with my wrinkle, but I want to look younger? And in fact, when we're using the word anti-aging, is misleading, because we cannot stop aging, and we should not use anti-aging. I use anti-aging, but we should not use, because we can't stop aging process, but we can help. The most appropriate wording should be the pro-aging or age gracefully, but not anti-aging, because it's impossible. So to answer to your question, yes, patients are more aware. Some definitely because they do their research, but some they're aware, but they ask without realizing.
Thank you. So I know you recently spoke at an international congress on the topic of regenerative medicine, myth or reality. So let's start with the obvious question. What exactly is regenerative medicine?
Okay. Well, to understand the regenerative medicines or regenerative aesthetic, we need to look at the definitions. So it's what restore an organ which is deficient, okay? So this is a proper regenerative. We have to be very careful, because the line between medication and aesthetic or medical device is very narrow. So what we can say, what we can't say. So when we announce that the regenerative aesthetic medicines will restore an organ, will restore the skin youthful, they restore XYZ, it's a bit of again misleading, because we're not talking about medications. It goes towards, but hasn't got a straight action as a regenerative. This is the reality. So yes, I was a speaker on that congress, and it was about, is it a myth or is it a hype or a myth, really?
So it's obviously become a very popular term. It sounds like it might be being overused. It sounds like there's misconceptions from both the practitioner side and the patient side, from the patient side of things. Is that your take on it?
Definitely. The problem is, okay, in fact, we don't have influence on patients. Who's got more influence is influencers. Social media is bombarding with information. So if a celebrity is mentioning that they had, XYZ treatment, everyone want to have the treatment because they think that. But if we tell them, I would wait a little bit to have exosome. I'll take an example because we don't have enough data and we don't have enough information, and the study did not really standardize. So then they said, oh, he doesn't know what he's talking about. So we have to provide the treatment, but with honesty, because we don't have enough information about is the outcome is going to be copy and paste on all the patients, which we don't have right now. Polynucleotide exosome are too new treatment. We don't have enough information like botulinum toxin, which it's for more than 40, 50 years. So when there is a new treatment, we are working on eggs because sometimes, we can realize there is some side effect or, adverse event that initially they were not announced, and more we treat patients, more there is some adverse event.
So what aspects of regenerative medicine genuinely excite you as somebody in the field? What really excites you?
So regarding regenerative medicines, regenerative or longevity medicines, it's more about, the investment to the patient to help to reach a good result. I explain. It's for them. It's to realize that the treatment that we provide is not a one-off treatment. I did mention to you before. We have this two-way collaboration, patient practitioner. What we do represent 10%. 90% is going to be done by the patient. And what is for me the excitement, is not really an excitement, but enjoyment, is when the patient come back and they said, I follow your recommendation and it's true. I feel my skin far more hydrated. I feel my skin much glowy. I feel my skin more radiant. And in fact, everyone noticed. And in fact, we know that a skin which is in a better condition, more hydrated and so on, any treatment we're going to provide, they're going to last longer. Studies show it. So it's when the patient comes back and said, you were right, doctor.
And on the other side of the coin, which aspects of regenerative medicine are concerning to you? And where should practitioners be cautious about it?
So the problem is, regarding the regenerative medicines, it's knowing the source. Very important, because we have to know the source of what we are injecting into a patient face. This is the most important. You're talking about regenerative medicines. Regenerative medicines, we're talking about exosome. And you know that exosome, there is multiple, exosome. The source is human exosome. And we know in the UK, France, it's illegal to use those human exosome. Animal exosome is illegal, just synthetic. So very important to know the source, to get all the information about stability of the products, because we need to the company providing the products, they need to be honest about where the products come from, the source, the traceability, the cold chain. Stem cell, there is a cold chain somewhere. So why do they not respect the cold chain? So it gives us a bit of red flag. Should we trust them or not trust them?
Thank you. You mentioned earlier on that the term anti-aging is not particularly helpful. So what does healthy aging actually mean, if that's a better turn of phrase?
Healthy aging, It's someone who's looking really good for the age, first of all, and also they accept, they embrace the age, and they have a proper lifestyle, really, proper lifestyle. So they don't want to do too many treatments, and they're happy the way they look, and they're not always chasing up the useful look, which doesn't represent the reality, really.
And do you talk often to your patients about biological age versus chronological age, and what's your take on that kind of comparison?
Yes, well, actually, one of my sister-in-law, she's 57, and she's the biological age is 37. So she was really, really impressed by the results. She gained 20 years, and in fact, so is it really, really reflecting on the reality? But there is a psychological part who make the person very, very pleased. So positive minds, exceptional, really positive about this, and it's sort of, I carry on like that because I've got a positive effect on what I'm doing is doing really well. It does work, so I should carry on doing it because it seems to be very effective.
Thank you. So I'm guessing that these kind of conversations that you have with patients obviously require a lot of trust. Patients come in looking for a treatment, but end up having a much broader discussion about health and aging. What tends to be the breakthrough moment when patients begin thinking differently about all of this?
If they're in a rush, the financial position as well. Financial position is a bit of it's not a no. I think when we're starting to promote skin health in our clinic, we're starting to plant the seeds. So every time someone was coming for botulinum toxin or filler, I always used to say to them, it's a quick fix. Maybe think about investing into your skin a different way. So you plant the seed, and it start to grow. And when they come back and said, "Oh, Philippe, you did mention something about mesotherapy or something else. Can we talk about the deeper?" So it's no point. Someone, when a patient comes for a proper idea about the treatment, so it's very difficult. But you just plant the seed and inform them, and when they come back, they make their mind. They're starting to look at it, at the treatment, and they ask you, "Oh, can you send me on WhatsApp what it's about?" And they start to read, to look, and it's interesting. They say, "Oh, it's really what I want, actually." And then when they come back, they say, "Oh, can you give me some more information? How does it work? What is the cost, obviously? How can you help me?" So this is how it works. Planting the seeds.
Thank you. Now, during our earlier conversation, you shared a really valuable piece of advice from one of your mentors: 1 foot in ethics, 1 foot in business. I thought that was a really incredibly powerful phrase. What does that mean to you? Could you just talk to our listeners about what that means to you and how you embody that?
Listen, at the end of the day, we are a clinic, okay? We are a clinic. We have some overhead. I have some staff. I have to pay them. So I have some charges. I have, we're a business, okay? We're a clinic. We're a private business. We're not NHS. So we have some overhead. We need to have an ethic, because this is medicines. So we shouldn't. This is a medical act we're doing, first of all. But so it's why we have a bit of ethic. I did mention to you about exosome. It's a very good example. We need to know where the products are coming from. For us, the sources is very important. And being CQC accredited, we need to keep a source of where we're getting our products from. So it's very important because we have to be honest towards our patients. I cannot inject an exosome, a human exosome, and telling my patient, "You know what? This is synthetic exosome." Is a trust. So business and ethic. And every time I open a new boxes, I open in front of my patients. It's where the ethic is. At least they know that it's fresh, it's new, hasn't been used. It was in the fridge, so I've opened. Everything is done accordingly. So nothing can come back to me and say, "Oh yes, but I didn't see Dr. Philippe opening in front of me. So maybe it was out of date products." So and we record the batch number, the expired. Everything is ethic. It's a medical act.
Got it. And probing a little bit further onto the business side of things, as you just brought that one up, and you are running a business at the end of the day, what from a business perspective is working particularly well for you at the moment?
What is doing
From
really
the
well?
point of view of your clinic being a business, what are you particularly proud of? What's working really well from a business angle?
I'm not going to answer to that question directly. I'm going to say to you, I love my job. And because I love my job, I transmit this love to my patient. And they can feel that because I love it, they appreciate the fact that I'm not here just to make profit. I'm here to help them. So I didn't answer to the question directly, but indirectly is an answer.
Okay, no, thank you. And on the other side of the coin, what are some of the challenges and the bottlenecks of running the business that you mentioned? And patient-facing work is not always straightforward, and then the mere act of running a business, a clinic, having staff, all present challenges in their own way. What are the things which are most impactful to you?
The legislation in the UK, this legislation is a bit of is a shame, because I remember many years ago, UK was the reference who not do any aesthetic treatment. Nowadays is a bit, but it seems that the legislation is changing. So, but today is a bit of anybody can do everything. The regulation is a bit of a nightmare. So really, it's this is a challenge we're facing. The challenge, because I'm talking about this because when we have to deal with the treatment who's been done by a non-medical qualified practitioner, we have a duty to treat. But as much as me, he's the last one who touched a patient who is responsible. So where do we fit? We treat, we correct, or we don't. So should we refer? So it's a very, the challenges are more about this. It's not about competition, because the competition is always healthy, but unlawful competition about beautician, yes, is not great in this country. And also regarding what I didn't mention before.
And I guess as a business owner, you wear lots of hats. Most business owners do. What are the time drains for you as a business owner? What are the things that pull you away from the things that you love doing more than others?
I like to train, to teach. I like to train and teach. This is my favorite. So I like to share my knowledge. When I go abroad, I go to different countries to train doctors in different aesthetic treatments. So for me, it's a passion. So obviously, when I'm abroad teaching, I miss my patient, because I've been knowing some patient for 17 years. So it's a bit of sort of family. What I miss, my family and my friends, they're always around. I go quite often to France. It's a bit of I don't miss anything, because this is, for me, going to work is not, oh, I have to go to work. It's more about I said to you, a passion. But yes, we would like to have more more time to sometimes to speak to patient and so on. But there is sometimes a bit of a backlog, and we're always behind and so on. Sometimes we're behind. So the time it's not elastic. This is the problem. But otherwise, no, I don't. There is no regret in my life, work and hobbies. I don't miss anything really.
Thank you. So, looking ahead to the next 5 or 10 years, where do you think aesthetic medicine is heading from what you can see in the space?
So in the next 5, 10 years, I think even 5 years really, is all about going to be regenerative medicines, because it's all going to be just filling the line. It's just going to be more about understanding the aging process and how we can reduce or diminish the aging sign. So this is, I think, the future. One element that is going to be the future is going to be the clinic who catch the train at the right times, and not clinics say, you know what, I'm just going to do Botox fillers. I'm happy. Well, you're happy today, but next year is going to be a different story. So regenerative medicines, definitely. There is, you knew a few years ago, we always used to, everyone used to like everywhere, even in Europe, Middle East, South America, big lips, big cheek, big everywhere. And the trend is going backwards. So now everything is natural. Well, today the request is not a trend. Today the request is all about skin quality. And I think patients are more aware about the importance of the skin. Listen, what is the point to give big lips or big cheek to someone who's got a skin full of acne? There is no logical in that. There is no logical in that. So obviously there is a sort of body dysmorphia somewhere, because you try to fill the lines, to stop, to fill the gap, because you see your face with acne, which doesn't please you. So in a way, you replace by putting some more volume. And in fact, it's the 5-10 years is all going to be regenerative medicines, but real regenerative medicines.
Do you have any sense? Sorry,
slowing the aging process.
Do you have any sense of what might happen to life expectancy?
Well, life expectancy is it only can rise if lifestyle is changing, exercise, food habits, stopping sugar intake, because we know that sugar is an addiction. I'm a sweet tooth, so I love sugar, but I try to refrain. So lifestyle is only going to increase if someone wants to help themselves. You cannot spoon feed someone who doesn't want to eat.
I hear you. And what about you personally? What's on the cards for you in the next 6 to 12 months? Do you have any plans or goals for the practice over the next year or so?
So the 12 months is going to be opening another clinic abroad, and I have the hope that the wish that the two clinics, one is going to go soon ahead, and the other one is going to be is on the pipeline. I will be focused on the second one as well. PHP branded.
Mm-hmm. Got it. With that, Philippe, I'd love to thank you so much for joining me today. It's been a really fascinating conversation. Thank you. I think one of the biggest takeaways for me has been this whole thing at the future of aesthetics is far less about treating visible symptoms, far more about understanding the biology of aging itself, which is something I really embody in my work in functional medicine. So thank you for sharing your insights, your experience, and your perspective on regenerative medicine, longevity, and the future of healthcare. It's been a pleasure having you on the show. Thank you so much.
Thank you, Andrew. Thank you very much for the invitation.